We will wrap up testing, both working with the NCDC and ourselves. We've complained over the period that we've seen a global shortage of the reagent, but we have wrapped up the supply. We have wrapped up contacts and ensuring that we can access this very critical component of our testing, and we will be seeing increased number of testing as we go into the weeks ahead. But it's also important for us to also share a few good news, you know, even whilst we continue to see only mild to moderate cases in Lagos. I'm sure you are aware that during the week we're able to also treat a patient that was COVID positive through a cesarean birth. We're able to bring out a baby alive, and this is the third in the series of patients that have been COVID positive, but they've been pregnant, and they've been very successful operations taking place at each and every one of them. We also, over this period, continue to increase our capacity and our capability at our various, not only isolation center, but now we're pushing the capacity and the capability to our primary health institutions. Because we're aware that the virus is community-based now, it's important for us to be able to cascade down how we track and how we monitor it. And so we are going to our primary health facilities, and we're trying to develop capacity and capability at that level. Just yesterday, I'm aware of an extensive workshop that the health workers at the very senior level held, and the strategy of how they're going to do that has been fashioned out at that intensive workshop yesterday. And in the days ahead, we'll be seeing some very specific conversations around how we intend to take the isolation and the treatment to the real community, which will be at the primary health facilities, which will have all around our 57 local government and LCDA. And I cannot continue to thank our frontline workers enough. I cannot continue to thank all our health workers, all our ambulance drivers, all our doctors, nurses, pharmacists, everybody that has been on the front line. I cannot continue to thank them enough. They are part of the reasons why we're encouraged to be certain that we will overcome this pandemic, and we'll be doing that as we go along. But I think it's important at this point to also inform Lagosians that between the last 2 weeks, we've seen, I'm sure you're aware, that we've had to take over the first set of Nigerians that came in from Dubai, and about 250 of them. They are currently being isolated or quarantined at 2 facilities in Lagos, one in Ikeja and the other one in Lekki. And like the commissioner pointed out yesterday, 3 of them had positive cases of COVID-19, haven't gone through the test, and the 3 have been isolated from the other returnees, and a whole lot of them are currently under our care and management. We're hoping that by the end of the week coming, they will have completed their 14 days isolation. I would also like to inform that there are some Nigerians from the Badagry border that we also had to take into one of our isolation, in fact 2 of our isolation facility in Badagry. They crossed from the border, I think it was about 3 days ago. Initially there were supposed to be about 156 of them, but I think that number has reduced considerably. I think we have only about 20-something of them in our facility in Badagry. And typically we are going to isolate them for the next 14 days, and they will be tested, after which they will be released and discharged to meet with their families. I'm sure you know that today at the end of today, we'll be completing the first 2 weeks of the phased lockdown or easing of the lockdown, as was announced by the Presidential Task Force, which they said is in 3 series. So we're actually from tomorrow entering a second phase of that easing of lockdown. And I must say that we, on our own, over this period, have had extensive conversation with all of our stakeholders, from all of our religious leaders, both the Islamic and Christian followership. I've had meetings with all of them. I've had meetings with most of our traditional rulers, first-class rulers, second, all of them. We've had extensive conversations with them. And also, even in the course of this week that is going, I had meetings with the organized private sector, representative of the organized private sector from the Lagos Chamber of Commerce and Industry, the Nigerian Employers Consultative Assembly, and also the Manufacturers Association of Nigeria. And we're putting heads together. A whole lot of ideas have been given to us, and a lot of collaborative efforts are ongoing between ourselves and themselves on how to see the best means of also further easing out the economy in the weeks and the days ahead. But I would say that part of the things that we want to immediately begin to implement is what we call relaxing the restriction on our elderly people. I want all our financial institutions and all of our markets, closed markets, especially the malls and stores, to be able to give preference to our elderly meaning 60 years and above. I want them to be able to open their banking halls and their stores to them from the hours of 9 o'clock in the morning to 10 or 10:30. Elderly people in our society must be given priority to enter the banking hall in the morning, to be able to transact their businesses between the hours of 9 o'clock and 10:30, and also be able to enter a lot of these malls and a lot of these closed stores and open stores between the hours of 9 and 10:30. We will ensure that we'll keep to this time as priority for our elderly people in our society. And I think I want them to take advantage of this timing to be able to do their own personal shopping and transact their own personal businesses between this time before we'll allow other citizens to come in and also transact. We're also at the level where we are reviewing the other arms of the economy. And so in the coming days ahead, we'll be starting what we call register to open. We'll be starting what we call register to open, meaning that all of the players in the restaurant business, spa business, event centers, entertainment, the malls and the cinemas will go through a form of re-registration and space management. We will be coming to their facility. There will be a regulation that will be coming out, but we'll be supervising and we're coming to their facility to see their level of readiness for a future opening. When that opening will happen in the weeks ahead, I don't know. But we want them to begin to tune themselves to the reality of COVID-19, what their floor spaces needs to look like. An example is in a restaurant that used to seat 10 people, maybe it's going to be only 5 or 6 people that will be there now. A restaurant that, or an eatery that usually have plates and cutleries, maybe it's all going to be disposable plates and cutleries that will be allowed now going forward. These are some of the regulations or some of the changes that they need to get accustomed to. So that whole process, we're going to start it with them, either with the Lagos State Safety Commission, which will be strengthened in the coming days and weeks to be able to live up to this, and they will come up with a procedure on what they need to have. Because for them, it's not just to say that they should start tomorrow. There has to be a process before all of that can happen. Similarly, also at places of worship, as much as possible, we will be going and working with them to see their level of preparedness in the event that we're going to unlock them in future. How well have they spaced out their auditorium, their places of worship? How many people can it take at any point in time ensuring that we keep as much space as possible before we begin to see them being ready for that unlocking. In the coming weeks, like I did said, we'll see substantial decline with no exponential rate in infection. We'll be mandating the state agencies, like I mentioned, the Lagos Safety Commission, and also LASEPA, Environmental Protection Agency, to begin that enumeration process. And I'm sure they'll be communicating with all the relevant bodies and all the relevant houses and offices in the days ahead. I must, however, caution that this should not be misinterpreted, that it is for full opening. It is certainly not, and the economy is certainly not ready for that. Rather, this message is to pass across so that we're considering, we're reviewing, and we're preparing to see how that phase unlocking needs to happen. If we see huge level of compliance and readiness, then it can happen in the next 2-3 weeks. If not, it could take a month, it could take 2 months, until when we're sure that all of these players are ready and they've confirmed with all of the things that we're saying and will be bringing out in the weeks ahead. And I'm sure, as you are aware, it certainly cannot be business as usual. This pandemic has since shown us that a few things needs to change. You know, the way we relate, the way we act, and the way we need to begin to do our businesses going forward. We'll continue to update and inform you of our decisions on our changes, you know, as this goes on. I must also say that in the 2 weeks that we've reviewed, they've seen some encouraging level of compliance around the open markets and the non-food markets. But however, we believe that the compliance can also still be improved upon. And so we will still keep the days of opening for non-food markets to be Mondays, Wednesdays, and Fridays, and for food markets to still open on Tuesdays, on Thursdays, and on Saturdays. And I'm hoping that people will take full advantage of this government gesture. We have not seen an 80 or 90% compliance yet, but we're encouraged after the first 2 days that the level of compliance is increasing, and we hope that in the days going forward, we'll even see further improvement. I must also express that we're not very happy with the yellow buses at the level of compliance. Their union have assured us that they will continue to work on their members, and we've seen that commitment from them, but it's still a question of the followership, and we'll continue to work and encourage them that they impress on their followership. The security operatives are here. We do not want it to become an arrest issue. We want it to be a self-compliant issue, because when you self-comply, it's a whole lot easier on all of us. You know that the BRT and the high-capacity buses, they are complying, and they are complying well. And I want to thank them for that level of compliance. But like I said, there's still a whole lot more room for improvement from all of this sector. Regarding face mask, we've also seen a bit of encouraging, but a lot of people still in the public places are not complying. The federal government of Nigeria has insisted that face mask is now compulsory not only in Lagos, but right around the Federation. Anytime you're in a public place, please ensure that you're wearing a face mask. It is not only to protect yourself, it's also to protect you from others. And so please, like I did mention at the last address, people need to take responsibility. We need to take full responsibility for ourselves and for our loved ones. And we cannot stop at ensuring that people do this at all times. As a government, we have distributed over 1 million masks already, and tomorrow we have over 1,000 people that will be going out, and they'll be going to all the local governments, and they'll be giving out free face masks as well, just to ensure that we see higher level of compliance from our citizens. So we will also be distributing free face masks to hundreds and hundreds of thousands of people tomorrow, and you watch them, they'll be out there trying to give out to people that do not have. And I'm hoping that people will see this gesture of government as a positive note for collaboration. I want to thank the collaborative efforts of our security operatives. I know that we have not seen the level of compliance that we would have wanted from the interstate journey travel. Like I did mention, our borders are only restricted or will bother only Ogun State. And so we're seeking this collaboration and this collaborative effort from the Ogun State government and the Nigerian police in Ogun State. We've seen it. We're just believing that we can work a lot better with it. And so the security operatives here have assured me that they will leave nothing unturned. We've seen issues where people that are meant to be bringing essential services in and out of Lagos are disobeying the rules of how many people they can take and in what time of the day they can travel. But they've assured us that even in the weeks ahead, they will see and ensure that we comply with these things, and their monitoring and enforcement will be improved and improved upon. So I want to thank you very much, gentlemen, for your support thus far. Let me restate again, as I said in my last address, as a government elected to uphold security of Lagos State, this also includes the health security of our people, and we certainly will not hesitate to review the terms of easing if we continue to see evidence that Lagosians are determined to flout the rules. Our message is simple. Lagosians must not take the easing of the lockdown for granted. We need, all of us need to take responsibility. There are reports of, like I said, some gym, some barbing salon, some barber shop that are opening secretly. Not until when you validate, or we come and validate what your space structure look like, and we're coming up with those regulations, you will be locked down. And we're saying this with all seriousness. We know that you need to get your business on, but we also need to ensure that you are doing it in an atmosphere where you keep both your clients and yourself safe. I want to reiterate that we will not hesitate to shut down any of those businesses if we realize or find out that they are not complying. I also want to thank all of the reports we get from our whistleblower. In fact, we've seen a tremendous response and tremendous usage of the lines that were given on from a lot of our whistleblowers, and we have responded. We've responded by ensuring that some offices are visited. We have not clamped them down. It's more of ensuring that they do self-regulation. So we've gone to some of them and we've appealed to ensuring that if they do not comply and we'll get a second whistleblower from them, we will be left with no option but to close them down. But we're happy that a lot of them are complying once our officers go and they found that they've not kept with all of the measures that have been stated or that have been rolled out. But we're happy that some of them are changing their ways and they are complying. But I want to thank all of our whistleblowers, and they should please continue to pass on these messages to us, and we're indeed happy that they are collaborating with us. Once again, gentlemen of the press, I want to thank you for listening. Like we said, we're still watching. Let us continue in the same manner, but we're hoping that even the level of compliance in the days and the weeks going forward will be far better than what we have seen in the last 2 weeks. Thank you very much.
All right, good evening, Mr. Governor. My name is Sheyi Fumi Olatide. I report for Lagos Television. My concern, or probably my question here, is that knowing fully well that COVID-19 targets the immune system of residents and people generally, is there anything the state is doing to point residents in the right direction about how they can naturally boost their immune system, coupled with the fact that we are practicing social distancing and using of nose masks? Probably this could also go a long way in stemming the tide of the spread. Thank you.
Okay. Good evening, Your Excellency. My name is Rose Blossom Moye from Galaxy Television. Basically, my question is about the part where you said there'll be increased capacity and capability to primary health care centers and institutions. I want to understand exactly how this increased capacity and capability will be reached out. And this next question is actually directed to the Health Commissioner. Based on the fact that with some findings, we realized that some people putting on the nose mask for quite a long time get to have they tend to lose breath. They tend to collapse, some of them with findings. We realized that a lot of people cannot wear this for too long, which can make them lose oxygen. I don't know, there's a medical term for that, which is hypoxia. I don't know how we can come about that. Like, how long do you think someone can pull this on? Or is there any other way or anything else that we can do concerning this nose vac? And I'm saying this because of we have a lot of people that have health conditions in this aspect. Thank you.
Thank you very much. Thank you very much, gentlemen of the press. Aridoja, yes. So what are we doing, given the fact that it's probably going to be with us for a long time, and what are the plans, even post-COVID? Well, okay, so part of the things that we're planning to do and we started doing is our realization that we cannot also keep our people locked down forever. But we have to have a plan as into how we release, even that economy, and it has to be in a phased and in a gradual manner. Like I said, our lives certainly will not be the same again, and so we all need to learn to live, during and after post-COVID. You realize the backlash that happened 2 Mondays ago, when on the famous 4th of May, when the first lockdown was eased. You saw, all of you reported, how the level of lack of compliance, happened. But since then, we've seen a better improvement, both from the various financial institutions who had helped us to open a lot more branches, who had created a lot more ambience, and also the transport system, who had also seen the necessity for that. So that's really why I said that we're starting a process what we call register to open. The part of that model is understanding and realizing that other arms of our economy needs to open, especially people in hospitality, people in events, people in entertainment, and all of it, religious bodies, and all of. So we're getting into that phase, and what we're trying to do is we're trying to do what we call space management, right? So that they understand and we understand what their challenges are and how can we help them. So that's why we're doing a process flow with them, and like I said, in the days ahead, we'll be going. We'll need to monitor and manage how we live. And that's why I said that even it could get to a case where we'll probably be using at public places disposable plates, disposable cups, and all. So some creativity has to come, to how we manage all of that. But we realize and will appreciate that with the size of Lagos, you cannot lock it down forever. There is a science to it, there's an economic part to it, of course there's also a security part of it. So that's why all those three components, we're looking at them carefully, and we're ensuring that we do not leave any of them unturned. I also did mention that in the course of the days past this week, I still met with members of the organized private sector, and the questions we're asking is, what are the things that we need to do to ensure that they keep our people in jobs? What are the things that we need to do to ensure that they remain in business during and even post-COVID? And so these are some conversations that we've had. And really, as a government too, what are the interventions that within our own ambit that we can do for them to ensure that they become sustainable and they still have businesses even post-COVID? But like you said something, it probably will be with us. The eventual cure might be a vaccine. When that will happen, we don't know. But the encouragement that we have in Lagos is that if you see the level of recovery and the level of how our people, come out of it, not even knowing, that encourages us. So that means that either we have a higher immune system or we just need to double that to ensure that our people get well, even after having a virus. So I think I've answered the two questions, correctly. So channels, what are we going to be doing going forward, given the level of compliance and all of it? Well, you see, I've said it and I'm saying it again, we all have a role to play in this. That's why I said take responsibility. We all have a role to play. I have a role to play as your chief executive here, but all of you here to have a role to play at ensuring that we communicate this effectively to our citizens. We will not stop at ensuring that advocacy and communication is done on time and to all of the stakeholders that is needed. I mentioned to you now that to ensure that we comply, we've had meetings with all of our stakeholders, religious bodies, the traditional rulers, the ethnic groups, the various unions of the buses. These are all various stakeholders that also have a channel of communication with or to their members or to their subjects. So that's how you do it. Everybody must be speaking the same thing, must be explaining the same thing to our people. So once it gets comprehensive like that, people actually will see the sincerity of what we're explaining and be able to self-comply. You see, it's really not about carrying a hot sweep or trying to arrest people. That's not how you ensure that people need to comply. It's really more of explanation, it's really more of advising and ensuring that this is the best thing. And that's why we said about face mask. We need to ensure that whilst we're saying to you to wear it, let's also produce it for you and give it to you and show you that real examples that we want you to be safe and want you to be secure for yourselves and for your family. Except we find people that flagrantly want to risk their own life at the expense of others, then we need to take a decision, about that. We've warned, for example, the transport drivers who are here that when you come into a bus, they hand over a face mask to you, and when you're going to call, why would you want to do that? Why would any passenger want to risk their life? You can get a face mask for 200 naira, for 300 naira. Why would you want to risk that? So these are some of the conversations we need to have with our citizens. Why? You don't know your level of immunity. Why would you want to take yourself through that risk and endanger yourself for yourselves and for your family? So really, it's continue to ensure that advocacy and communication is paramount to us. People need to take responsibility, and there's no better person that can say than yourselves and myself. And so let's just continue to push that narrative for them. Well, the commissioner will answer some of the questions, but you talked about the 120 cases. What are the parameters? The parameter is very simple. He will still answer it. NCDC, for example, which takes the national body, said to us as a plan for us to test 2 million people. If that prognosis goes well, if you test 2 million people, Lagos being the epic center will take a 20-30% of that, even in terms of testing. So if you do a test of about 600,000 people in Lagos alone, it's just a very simple, normal analysis of the trend we've seen in the last weeks. 20% positivity, 25% positivity of 600,000 will give you a clear 120,000. It's simple mathematics, right? So it goes with the drive of the test. If you do the test, right, and you do the test more in Lagos than any other place, being the epic center, right, it's just a fraction of the positivity based on the percentage that we've seen over the trend that we've been doing for the last 1 or 2 months. But the commissioner is an expert. He will also show some of the data that he has, on that. Concerning the Dubai returnee, what exactly happened? He will speak to that, but I think there were just some men of the press that were overzealous. I think some people just overran themselves. The results were not out yet, and they were speculating that these were the results from that facility. And so when the real result came out, the commissioner, I'm sure, was in a position to report, clearly to everybody what is the state of that facility. And I think that was what had happened. Arise, what are we doing about waste management? These are our frontline, and these are our responsibility. We have cover for them. They are part of our global health coverage, right? And we have coverage for all of them. But we're not just throwing and leaving them. For waste that are COVID related, we have an incinerator. So some of these things are incinerated completely, right? And so they all have their protective gears that they're using, right? It's a different thing if you talk of general waste collectors on the road, right? So I don't want to get into that because what has happened is people that are even doing general home waste collection are saying we should give them PP, and we say how, for what? We know the numbers of people that are working at our health facilities, and we know the organizations there, and so those are the ones that we're taking, and they're just less than 5-10% of the total population that we have with the waste manager. So we're taking care of them, and they're very critical to us. Update on the 10 part of my staff that I'm sure you didn't even transparently commend us, because we wanted to be transparent. That was, and that's the only way we can keep it. They are back here, if I must say to you. They've been there and they've done. They've been treated. They've done well, and they are back at their duty post. And I'm indeed happy that all of them are back working with me, and I'm excited about that. What exactly are we doing? Level of immunity. How do we ensure that, my friend from LTV, how do we ensure that people keep or wrap up immunity, because that's one of the things, right? I think it's still a way of life. We cannot say it enough. You know, it is personal hygiene and ensuring that you exercise, you eat well, all of the various food that you need to have for you to have some sort of, like, the word is not a balanced diet, but an adequate, diet. The ones that are within your pit. I do a 20 lap around here, when I want to, so you just need to, help yourself. You need to know what your challenges are, what you can do. If you cannot run, if you cannot jog, you run. If you cannot do something, just ensure that at least you can breathe well. Come out of the fresh air, stay under the sun, absorb some vitamin D, component. Understand when you need to eat, where you need to eat. Check what you're eating, and ensure that you have a good hygiene, have a good respiratory system. These are some of the things that can generally just improve, your metabolism and the level of immunity that you have. Just general, simple things that people just need to do. Eat more vegetables, and there's so many of them around, right? They're everywhere around. Turn to a farmer yourself. Have some of those things right behind your house, right? We have one here now. So these are some of the things you can do just to build your own personal immune system. And the literatures are out there, but it's still part of taking responsibility. And I think I cannot stop at that. We need to be able to do that for ourselves. Rose talked about, how do we intend to wrap up capacity at the PHCs? So I mentioned it, and that, I mentioned also that there was a tough workshop that the health practitioners had yesterday, and I just bumped in for a couple of hours to listen to them, and so that's why I know that they have a plan. The plan is very robust and is very extensive. We certainly cannot use all of our over 360 PHCs because all of them are different levels of usage. All of them are different levels of infrastructure development. So we'll have a class A, which are about 60 of them that can stand, as a quasi, secondary health facility. They are the ones that will take very first to wrap them up. Most of them can take, 10 to 15, 20, patients. So they will look at what is available there, what is the staff that is available, and what are the training that they require. These ones are closer even to the citizens, they are closer to the communities than our own isolation center. So it's more of training, it's more of capacity development or capacity building and equipment, and it's really just to have the ambience to be able to. There are no sophisticated equipment that is required or something. No, it's really just the ambience and the quality of the training that the people that will be servicing them require. But the commissioner can also still speak to that. But I'm aware they have a robust plan and they'll be taking us through that. I think your last question was regarding wearing of a face mask. I think that's more of science. I also cannot answer that, and I think I'll leave that to the commissioner of health to answer. How long can you? But what we've said is very clear. It's only when you're in a public engagement. If you're in your house, if you're in your office, or if you're in your own personal space, you need not have one on. If you're in your own personal space that is controlled, you need not have one in your house or even in your car. If you're in your car and you're the only one driving, you need not have one, right? It's only when you think that you could be an endangered to someone that is with you, or somebody can actually be endangering you. That's really when you need to scale up, wearing a face mask. But if you're in your space, you don't have to. Thank you. But the commissioner will speak to some of those things.
Thank you very much. I'll talk around the modeling question. So normally modeling or prediction of numbers of cases is a combination of modeling and the real life data that we see. So the modeling is based on the infectivity rate of the virus, and we know that one person infected will infect 2 to 3 other people per day if he comes into contact with them. So there's a doubling time of the virus, and that is an exact science. And then we look at how that relates with the number of cases that we're seeing. So if you, for example, the virus has the opportunity to spread to 2 or 3 people, but you actually practice social distancing properly, then the virus for that day may only have the chance to infect 1 person. That is how social distancing works. So you reduce the capacity of the virus to do what it normally wants to do, which is to infect between 2 and 3 people a day. So as we tell you and give you the guidelines for social distancing, you're actually interfering with the model. So the model may predict that you will get 120,000 in 3 months, but if you obey what the government is saying and you practice good social distancing, that number may actually come down to half or even less. And that's how our trending analysis goes.
How about testing? You also test, the testing from federal government.
Yes, and also testing. So the more we test, the more we'll find. Because for every 1 positive person in community, we know that there are maybe 10 others that have been infected. So the more tests we do, the higher we will find. And when we calculate that, and we calculate the knowns and the unknowns, we can arrive at some projection of what we think the total number of cases will be in our environment. You wanted to ask about the gentleman that was one of the returnees from Dubai. The way we reported it, because they're in isolation for COVID, and you turn sick, the presumption is that you had a COVID-related illness. And it is a matter of precaution. So when we transfer you to a hospital, we transfer you as a presumptive COVID case. Now the gentleman was very ill and he was transferred to the hospital and he demised very soon. So we had to assume it was COVID related until proven otherwise. So when we did the tests after his death, we confirmed that he was actually COVID negative. But up until that result was ready, we had to report him as a possible COVID-related. And I think the press misinterpreted that kind of communication and immediately declared that his cause of death was COVID. He had some very serious underlying pathologies, which is why he went to Dubai. But we were not informed of what those pathologies was on his arrival, and then he suddenly turned ill and was transferred to a hospital where he died very soon after on arrival. And we know that that's how COVID works as well. If you're very sick with COVID, the rate at which you die can be very fast. So to protect the staff and even the corpse handlers, we have to assume it is COVID until we get the test back. And as soon as we got the test back, we relayed that information to the public and the press.
Mask. Face mask. No. Face mask, how long can we?
So how long can you wear a face mask? Well, a face mask is supposed to be designed so that you can breathe through it. Some people are making some face masks that are very thick with 3 layers or 4 layers. If you put it on, you have difficulty breathing. So if you're wearing a properly designed face mask, you should be able to wear it for a number of hours unless you have some underlying breathing problems. But a normal person can wear a face mask for several hours, provided it's not a mask that's too thick and is obstructing your capacity to breathe.
Thank you very much, gentlemen of the press. Thank you very much thank you.